Okay, the cardiac system. This is composed of the heart and blood vessels, and then we'll talk about the anatomy, the electricity in the heart, and how it's pumped throughout the body, and then the disease states that affect the heart and the blood vessels. So the heart. Let's start with what the heart is. It's a hollow muscle that's in the chest between the lungs, and it sits just behind your sternum. Another word for that is the breastplate. And the heart beats from before 12 weeks of pregnancy until the day a person dies. And its function is to pump blood throughout the body. And the reason this is needed is because the blood carries nutrients and oxygen to all the cells of the body. And then the cells also are able to dispose of waste products. And the waste products are then either removed from the kidney, the liver, and in the case of CO2, we breathe it out via the lungs. Okay, so here are two images of the heart. The top image, as you can tell, is a real heart, and this may be human or it could be an animal heart. And it's about the size of a person's fist for humans. And the bottom image, of course, is a diagram. Now, the blue vessels are deoxygenated blood, and the red vessels represent blood that has oxygen. So the great vessels are the aortic arch, and then that you see in this image, and then you have the inferior and superior vena cava, which are blue, and they go into the right atrium. And then you have the pulmonary arteries, which branch off into the lungs. So the next image that's cut through the heart will talk about the actual flow of blood. And then the other thing you see here are the coronary vessels, which are really important because the blood supply that goes through the coronary vessels is what gives oxygen to the actual heart muscles. And as you'll learn later, blockages in these are what lead to heart attacks. And then you can read kind of the rest of the labels on your own. So here's another image of the heart, and this is cut through the center. So you can think of the heart as a double pump, and it has a right side and a left side. So the purpose is, as we said before, is to pump blood to the body, and it's like a closed loop. So the blood pumps, or the heart pumps blood to the body, and then it comes back to the heart via the venous system, and brings blood back to the heart. So let's start with the inferior and superior vena cava. The blood from that goes into the right atrium, and then the right atrium, when it contracts, will squeeze blood into the right ventricle, and it goes through the tricuspid valve. So then the right ventricle, when it contracts or squeezes the blood, it goes through the pulmonary valve into the pulmonary arteries, and then that goes to the lungs, where the blood is then oxygenated as it's passing through the capillaries around the alveoli, and we'll talk more about that anatomy in the next few slides. So then that oxygenated blood will then come back to the left atrium. It'll go through the mitral valve with contraction, and then it'll go into the left ventricle, and then it goes through the aortic valve and then out to the aorta. So it basically follows this pathway every time. And each heartbeat is when the blood passes through this whole system and then gets pumped out to the body. So a person's heart beats on average about 80 times a minute. In kids, it's a little faster. In some disease states, it can be a little bit higher. People that are really good athletes may have a lower resting heart rate. And so basically, every heartbeat is going to pump blood all the way through this cycle. And both atria actually contract at the same time. So the blood is getting squeezed from the atria to the ventricles. And then the ventricles also contract at the same time, and then the blood gets pushed into the arteries. So this is a closed cycle, so the blood is always stays within your circulatory system, and it just pumps the blood to the body, then it comes back to the heart, and then it just repeats itself. And then you can read kind of the flow of blood on the side here, where I go through the deoxygenated blood from IVC to SVC to the right atrium. And you can read that on your own. And if you're a student, the only way to really remember all this is to memorize it, if this is all new terminology for you. But in the next few slides, the whole thing will make a little more sense. Okay, so this is just another image of the heart and showing its relationship to the lungs. So you can see in the lungs, you can see those vessels, and so the blue is the deoxygenated blood that comes from the heart to the lungs. And then it becomes red once it's oxygenated. Once it gets oxygen, there's a gas exchange, which we'll talk about in another slide. And then that oxygenated blood comes back to the heart, and then it gets pumped out to the body. So this cycle repeats itself. So now here's a more detailed picture of what's happening inside the lung. So when we breathe in air, about 20% of the air contains oxygen, and so that's what we're breathing in. And all of those go to the terminal parts of the lung, which are called alveoli. So they're basically look like little bubbles of air. So here's an air within one of the alveoli. So as you can see, there's like a network of arteries and veins. Well, at this stage, they're so small, they're called capillaries. So they surround these alveoli. So you'll see here's a part of the capillary that's blue, which is the deoxygenated blood. So as the blood is traveling through the capillary, you'll see that there's these red blood cells in here. And when it's blue, that's when it's deoxygenated. So because the alveoli have fresh air, which is 20% oxygen, this allows for diffusion of the oxygen from the alveoli into the capillary. And the oxygen will attach to the red blood cell. And then from the red blood cell, the CO2, which is in higher concentration here in the blood, will then diffuse into the alveoli. And then from there, when we breathe out, that's when we're breathing out the CO2. And then when we're breathing in the oxygen. So, breathing and the heartbeat is all for sending this blood through in order to exchange oxygen for CO2. And this oxygen later will then travel, through the aorta systemically and reach all the cells. And the oxygen plays a vital role in energy production, as you'll learn later. So here's the full circulatory system. So from the heart, you have the great vessels, which will branch off into smaller and smaller vessels. So as I said, the aorta is the largest vessel, so it kind of arches up from the heart and then travels down through the abdomen and splits into the legs. And then superiorly, it'll split into the arms and then again into the neck and supply the head and neck. So again, we can look at the specific names of all the arteries and veins a little bit later. But basically, the largest vessels in the body are called arteries. As they get further from the heart, they'll become smaller and they'll become what are called arterioles or venules. And then from there, they become capillaries, which are very thin, or which are very small vessels. And they create a mesh-like network around all of the organs. And this is how all the cells and all the organs exchange their waste products and then take up oxygen and other nutrients like glucose into the cells. So the red represents oxygenated blood traveling away from the heart, and the blue represents deoxygenated blood traveling to the heart. Okay, and then here's like a depiction of what a capillary is. So here you have an artery, which is the largest vessel, and it's composed of multiple layers. And then you have an arteriole, which is a branch that comes off the artery. and then it'll become smaller and smaller. So it kind of forms this mesh-like network, and as it extends further from the artery, it becomes smaller until it's like large enough to just accommodate a single cell, for example, the size of a red blood cell, can pass through that. And then this is surrounding all the different organs. And again, you'll have oxygen that comes out of there, as well as nutrients such as glucose or vitamins and minerals. And then you'll have waste products that are made by the cells and carbon dioxide that'll then diffuse into the venous side of the capillary. And then from the venous side, the capillary network becomes bigger and it'll become what's called a venule here. Then the venule then will dump its contents into the larger veins. And then those will all head back towards the heart via the inferior vena cava or the superior vena cava. And then here's again a picture of the circulatory system. So now we can look at a couple of the major arteries. So from the aortic arch, the first branches are going to be the common carotid artery. And then those go into the head and neck, and those branch further. And then into the arms, you'll have the subclavian arteries on the right and left, and then they branch further as you go through the arm into the axillary artery, for example, and then the brachial artery, and then you've got the radial and ulnar arteries. And then from that, you have many, many capillaries that extend throughout all the tissues. And then as you travel down, the aortic arch goes through the chest. It'll give off thoracic branches, and then it'll give off branches into the abdomen, such as this superior mesenteric artery, inferior mesenteric artery. You've got the renal arteries, and then they'll branch into the external iliac arteries, which will then supply both the legs, and then you have the internal iliac arteries, which supplies the organs of the pelvis. And then you can read all the different names of the arteries. And on the venous side, they're named the same thing at the same level. So you have an external iliac artery, and you'll have an external iliac vein, for example. The only unmatched would be, for example, the aorta, which is the major artery. But in the venous side, it's called the inferior vena cava and then the superior vena cava. Okay, so we talked about the heartbeat. Well, what causes a heart to beat? As I said before, it starts at about 12 weeks of age. Once the heart has developed in the fetus, it'll spontaneously start a heartbeat. Well, it starts in the sinoatrial node, and that's called the pacemaker of the heart. So whatever rate your heart is going, it's based on signals that this SA node is creating. And these are electrical signals. And those will travel to the AV node, and when this happens, this causes the atria to contract. So it's this electrical signal through the heart that's causing the atria to contract. And then from there, it'll go into the bundle of His, and then it'll spread down into these Purkinje fibers. So it kind of goes down the interventricular septum, and then it goes back up through the lateral ventricle walls. And that'll cause the ventricles to contract. So, as I said, those are all electrical impulses. Well, here's what the electrical impulse looks like on an EKG, which stands for electrocardiogram. So these are all the basic components. You have a P wave, which represents the atrial depolarization, and then you have a QRS wave, which represents the ventricular depolarization. And then you have the T wave and this U wave. The T wave is ventricular repolarization. So what does that mean? So during the atrial depolarization, after that occurs, the atria will contract. So this is the atria contracting. And this big peak here is when the ventricles will begin to contract. And then during this phase here, they're recovering. And then this whole set of waves will be repeated. So in a normal person with a heartbeat at 80 beats per minute, you'll see these waves over and over again, and you can count them happening as 80 times a minute. Or if somebody has a heart rate that's 120, then you'll see these waves 120 times in a minute, for example. And you know, reading EKGs and going further into the physiology is not the purpose of this particular video. Just wanted to go over the basics of what is. Okay, so now that you've learned a little bit about the anatomy and how the heart works, there are a few measurements that we take routinely that kind of gives us an idea of how the heart is doing. So one is a heart rate, which you can listen to and count, and then that's defined as just the number of times the heart beats in a minute. And so somebody that has a fast or slow heart rate for their age would be something to be concerned about. And then the other thing that's usually measured is a blood pressure, which what that means is there's two numbers, a systole and diastole. So systole is the pressure in your arteries when the heart, when the ventricles contract. And then diastole is the pressure in your arteries when the ventricles are filling. So the top number is systole and the bottom number is diastole. So the average normal for an adult is around 120/80. And many women typically are lower, say in the 90 to over 70 range. And previously it was said that elevated is greater than 140/90. I think under the newer guidelines, they're saying even 120 to 129. And 80 can be considered elevated as far as the systolic number. And then you have like these stages of hypertension. So you have stage 1, 2, and then the last one there is called a hypertensive crisis. So once you're at stage 1 and 2, you know, your doctor may recommend lifestyle modifications, decreased salt intake, weight loss, things like that, maybe to quit smoking, and you know, give that a try before you start on medications. And then, you know, again, depending on your overall situation, and then as it, you know, it becomes more elevated, if it's not controlled, then most likely you'll be put on a blood pressure medication. So anything higher than 180/120, as it says, is considered a hypertensive crisis, and you know, that's something that could lead to very serious complications. But again, this is kind of just for informational purposes. And another parameter I have here is stroke volume, which is how much blood is ejected from the ventricles each time it beats. And the purpose of that is for someone who has symptoms, that's something you can measure, and that's somebody like with congestive heart failure who's not able to pump out as much blood as they should because the heart is weak, and that can lead to symptoms, and you know, that leads to less oxygen getting to the cells of the body, which is what kind of leads to symptoms of fatigue, feelings of weakness, and things like that. So so these are some of the cardiac parameters that are looked at when you visit the doctor, like especially the heart rate and blood pressure. Then we come to diseases of the heart. So heart attacks are actually the #1 cause of death in adults, and that's over 500,000 within the USA. Another one is, it's a heart attack, but that doesn't kill someone, but it can weaken the heart. So some people can survive, some people do survive heart attacks. However, some parts of the heart may be damaged, and that can lead to other problems, and they have to be on medications, and they're at increased risk of sudden cardiac death. Another disease is called congestive heart failure. That's when you have damage to the heart, and it leads to kind of a weak pumping of the heart, and that leads to multiple symptoms. And again, I just want to touch on all of these briefly without going into all the details of each one. The next one is coronary artery disease. It's when you have plaque buildup in the coronary arteries, and this is what actually leads to heart attacks and MIs. And then you have arrhythmias such as atrial fibrillation, This is when you have a problem with the rhythm, it's not beating regularly. Some are easily treatable, however, some arrhythmias can lead to death. Then you have congenital problems, which is usually a structural problem with the development of the heart in the fetus. And some of them can be surgically corrected. Some the person may live with for a lifetime, and they may have some weakness or symptoms from that. And they may have an earlier chance of dying from some heart disease. Then you have aortic disease, and then there's valvular problems such as mitral valve stenosis. And then there's something called cardiomyopathy, which is kind of the diseased muscle, and sometimes that can be caused by infection or certain autoimmune diseases, for example. So again, we're not going to go into all the details of the diseases, but just wanted to list a few causes of heart disease. And the most common cause is of death in adults is a heart attack, or another name for it is a myocardial infarction. Some die from it, and some may damage a portion of the heart but still survive that. Okay, well, that's the end of the cardiovascular video, and it's a lot of information if it's new terminology for you, so I would recommend going back to the slide that you want to memorize and just putting it on pause, and then you can read over the slides. And of course, you can always use any anatomy book. So the next video is going to be my Nutrition 2 lecture or video, and then after that I'm going to do one on the GI system.